We're going to take items 108 through 116 together. Authorizing Mayor President to amend a sub-recipient contract with Capital City Family Health Clinic for an increase in the amount of $506,557 for a total amount of $718,057 awarded under the Ryan White HIV AIDS program by Human Services Director. Authorizing Mayor President to amend a sub-recipient contract with HIV AIDS Alliance for Region 2 for an increase in the amount of $152,832 for a total amount of $205,828 under the Ryan White HIV AIDS Minority AIDS Initiative Program by Human Services Director. Authorizing the Mayor President to amend a sub-recipient contract with Volunteers of America South Central Louisiana for an increase in the amount of $144,928 for a total amount of $203,508 under the Ryan White HIV AIDS Program by Human Services Director. Authorizing the Mayor President to amend a sub-recipient contract with Capital City Family Clinic for an increase in the amount of $77,751 for a total amount of $109,980 awarded under the Ryan White HIV AIDS Minority AIDS Initiative Program by Human Services Director. Authorizing the Mayor President to amend a sub-recipient contract with Family Services of Greater Baton Rouge for an increase in the amount of $623,121 for a total amount of $883,328 awarded under the Ryan White Part A and MAI program by Human Services Director. Authorizing Mayor President to amend a sub-recipient contract with HIV AIDS Alliance for Region 2 for an increase in the amount of $846,896 for a total amount of $1,165,987 under the Ryan White HIV AIDS program by Human Services Director. Authorizing the Mayor President to amend a sub-recipient contract with No AIDS/Task Force for an increase in the amount of $69,118 for a total amount of $122,004 by the Human Services Director. Authorizing Mayor President to amend a sub-recipient contract with Our Lady of the Lake, Inc. for an increase in the amount of $321,470 for a total amount of $463,985 awarded under the Ryan White HIV AIDS program by the Human Services Director. Authorizing Mayor President to amend a sub-recipient contract with Our Lady of the Lake, Inc. for an increase in the amount of $53,348 for a total amount of $75,409 awarded under the Ryan White Minority AIDS Initiative Program by Human Services Director. Anyone here wishing to speak on these items? Please state your name for the record.
Penny May. I'm speaking in opposition to all of the items. The three previous items, 105, 106, 107, amount to approximately $7 million in grant funding. The items 8 through 16 total approximately $4 million for taxpayer-funded contracts. The AIDS, I'm so tired, HIV epidemic is pretty much over. I did some research to find out how many active AIDS cases there are in East Baton Rouge. Does anybody know how many active AIDS HIV cases we have that we're getting ready to spend $4 million on? Anybody know? Is there anybody here who knows? Is there somebody who can speak to that?
Ms. May, I know you've been coming here because you're running for office, but no, because I want to clarify because you keep asking questions. From the health department here? Listen, you keep asking questions to this body, and the public may look at that and say, God, this council's rude. They're not answering any of her questions, but I want for the public to understand that that is not what this portion of the meeting's for.
Okay.
This is your time during the public hearing to talk. Then we'll take it to the council. If somebody wants to address your question or ask you a question, they're welcome to do that. But I want the public to understand that we're not responding to you for that reason. I'm going to give you extra time.
Okay. I was wondering how many active HIV cases there are in East Baton Rouge today. So I did some research, and what I came up with was the latest figures were from 2020. And at that time, which was 4 years ago when there was more of an epidemic than there is now, it was approximately 1,800 cases. So do the math. We're going to get $7 million in funding. I'm asking y'all to oppose the $4 million total of these agenda items and, put that money into mental illness, because I rarely see taxpayer money come up to go towards addressing the serious mental illness issues, which are far greater than the HIV/AIDS. So please consider opposing these items and letting the $7 million in grants take care of the less than 1,000 people that this is impacting. Thank you.
Anyone else wishing to speak on this item?
Council members, you should have received one email comment in opposition to items 108 to 116.
We'll go to council. Councilman Dunn Jr.
Ms. Landry, I don't know the East Baton Rouge Parish numbers, and I'm not asking you to comment. I'm just responding to your question. But the nationwide numbers, in 2023, there was an estimated 1.3 million people affected with AIDS and HIV worldwide. That's down 39% from 2010. So to your point, there has been a decline in affected individuals with AIDS and HIV. But what I would impress upon you and others is that is the result of the work that many of these organizations are doing. And that's why we need to continue to fund the work that they're doing from an education standpoint, from an awareness standpoint, from a prevention standpoint. Those numbers didn't decline by themselves. Those numbers decline because of the work that these organizations are doing on the ground to make sure these numbers are not increased. So I wholeheartedly support these items. Let me let the record reflect that I'm abstaining from number 109. But the work that these individuals are doing, Capital City, AIDS and HIV Alliance for Region 2, Volunteers of America, U.S. Department of Health, City Parish, the work that we are doing and they are doing on the ground is the result of these numbers decreasing throughout the country and the world, and these numbers decreasing in East Baton Rouge Parish. Thank you.
Councilman Moak.
22,497. 22,497. Now, that's statistics from 23. Again, like my colleague said, these programs are in place not only to prevent our HIV patients from contracting full-blown AIDS, which at that point, there's not a lot you can do about it. So we have to have these programs in place. Also, these programs are not just for the LGBTQ community or anything like that. This is for all individuals. You know what? I'm just going to say it like this. I'm appalled that you would stand there in front of this council and talk about how we do not need to assist the community or assist these people in training, education, and also providing much-needed drugs and medications to prevent the spread of HIV and then prevent the spread of HIV becoming full-blown AIDS. It is something that we have fought since the 80s. To have the recognition that people feel comfortable to be able to come out and get this. You know why? The best I can describe it is, and we even look at this in our community, is you're a little bit right at the point that HIV is kind of like herpes now. It's something that it's not a death sentence when you get it. It's not anything that with the right preventative maintenance and everything that you can live a normal, healthy life. And that's because of these programs right here that people recognize are needed. And we rely on these services of these different people to go out into the community or have places that not only, I'll say it like this, my community can go to and not feel ashamed or anything else. So if it comes to every Ryan White, HIV, federal, state, local, or whatever, to keep these numbers down and keep going down, I will approve every single bit of those dollars. And you can sit there and, you know what? Never mind. I'm stopping. Right.
Councilwoman Rocca.
So a very simple, very quick Google search on this shows that in 2022, Louisiana ranked 4th in the nation for HIV diagnosis rates. New Orleans ranked 11th, and the Baton Rouge population ranked 5th. As of March 31st, 2024, 23,126 people were living with HIV in Louisiana. 10,969 of them had AIDS. In 2023, 875 people were newly diagnosed with HIV in Louisiana, with 25% of those diagnoses occurring in the New Orleans and 19% in the Baton Rouge area. Since 2018, Louisiana has seen an 11% decrease in new HIV cases. Then it goes on to talk about the populations that are most vulnerable for having AIDS or HIV. What you see is a decrease in the AIDS and HIV population due to testing, viral suppression, and pre-exposure prescriptions. But more importantly, for anybody that knows anything about how diseases spread and how health care is provided through Medicaid and Medicare, you would understand that the reason why a lot of these federal grants are given are to reduce the cost on the back end. It's less expensive for me to give someone a viral suppressant or to fight HIV than to pay for someone who has been hospitalized for full-blown AIDS. And taxpayers pay for both. So we look at certain things and we see the beginning, but we don't understand the end. We look at certain things that the government provide and we don't fully comprehend why the government is incentivizing these things and why the government is moving these things forward. And it's often because, believe it or not, the government was smart enough to do a cost-benefit analysis and see that prevention on the front end is way less expensive for the population than fighting full-blown AIDS on the back end. So with this governmental grant, I understand that there are populations in need, but I also understand the cost of healthcare, the rising cost of prescriptions, and how this helps in several ways and in several manners. But again, you know, we're all welcome to do our own research.
Councilman Hurst.
I'll just ask one question. How much is life worth? If you can tell me how much somebody's life is worth, then I can tell you what programs need to be defunded. And untreated, this is a disease that takes lives. And so when I looked at the national average for annual treatment for HIV and AIDS, this goes back to 2010, so I'm sure it's increased. That's the only number I could find. It was $23,000. So if it's $23,000 per the 1,800 people that you say we have in this parish, that's $41.4 million a year. So if the government is only having to supplement $11 million, which includes education and community outreach, I would support that any day of the week. So when you bring your numbers, make sure you do the math on all the numbers and ensure that what you speak about represents the whole and not a portion. And so this is only a portion of what we do to make the impact in the community, because there are people that cannot afford these drugs, especially the ones who are incarcerated. We talked about the cost of HIV drugs as it related to what's the prison medical folks to turnkey, and how that became a major issue with them getting refunded for HIV and AIDS treatment, and how it was really bringing down the contract and to where there was almost no profitability for them when they were losing, because there was that much treatment required within East Baton Rouge Parish Prison. So, and that's a small portion of the population. So I just say be sensitive to the people who are dealing with this issue. And again, I'll leave you with this: never put a value on a life. Thank you.
Councilwoman Banks.
Yes, I have a different perspective. In a former life, I was a HIV. I was a child protection investigator, and there's a population of students that we rarely think of when we think of HIV and AIDS. We mostly think it's as it as it relates to sexual activity, but I remember as a child protection investigator, the number of children that were born to HIV parents. It was our job to actually go to the home, and we couldn't tell the father, but we would tell the mother, and if they weren't getting medical care. So we don't talk about it a lot, we don't hear, but these are funds that also go to eliminate the transmission of HIV/AIDS from mother to child, which can come not only while in the womb, but also through breastfeeding. And so this is, significantly now only 2% of children that are born where there is a transmission where it cannot be treated through drugs. So there's rarely that we have a discussion as it relates to Ryan White funding, because by now, 20 years later, there's such a great understanding on where we've been in the last 20 years. Councilman Moog, during the 80s, when I actually worked for the American Red Cross teaching AIDS education, we could not even use the term homosexuality. We had to say men having sex with men, because there were so many men who were not identifying themselves as homosexual. They were married or they were in heterosexual relationships. So we had to identify based on the sexual beings and the activity, so that people would get the service and get the help that they needed. And so, I'm sorry that in 2024 we are even having this discussion. Because, again, it does save lives, and more importantly, it saves innocent children's lives.
Councilwoman Adams?
I have a question for whoever on the staff can answer this. If we were to not approve these funds, could these funds be used for mental health purposes?
Good afternoon. To answer your question, no, ma'am, we have to use it for the purpose that they were intended.
Okay. So these are federal funds, and we either use them for what the federal government says you use them for, or we just send them back.
Absolutely.
Thank
and for the record, we serve non-parishes.
Thank you. So my husband and I had the absolute honor about 4 years ago. We were able to foster a newborn baby who had been born to a mom who was not able financially to care for this child. But the mom was HIV positive and had been able to be a part of one of these programs, and was so proud, because these are not easy medications. They're very strict regimens that you're on. And this sweet little mom had done everything she needed to do for her unborn child, and that child had no viral load whatsoever when that baby was born. And such an honor to be a part of that baby's life and that mother's journey, and just all the respect in the world for her and the sacrifices she needed, and then the work that y'all do to make sure that child is now, at 4.5. Actually, she probably just had her birthday in August, and is a healthy young girl with everything wonderful in life ahead of her. So thank you for all the work that you do.
Thank you all for your support.
Councilman Moe?
Thank you. I'm just going to say this in closing, and I, as an elected official and as a person as I am, I have, I've never sit here and pushed an agenda. I've never, tried to change the world or how a government treats people differently or anything like that, and I never will. But when I have the opportunity, sitting here on this Metro Council since coming on, this is something I've never dealt with as an elected official before this, but when I work with these departments, and I worked with them probably for a year and a half in getting the extra funding for the incarcerated, and working with Turnkey and Open Health and the different organizations that we're talking about being with this funding. It is something that I'm proud of. It's something that I'm glad I get to be a part of it in the position that I'm in as the person that I am. And I just wanted to tell y'all in closing and y'all speaking and everything, I appreciate it's over the last 4 years of being with y'all. Every time something of this has come up, y'all have been 100% supportive and there for these programs and everything. And I thank y'all for that.
We have a motion by Councilman Moog, second by Councilman Hudson to approve. Any opposition? Abstention on item 109? Don Jr.? Motion carries. Councilman Hudson.
Real quick, I just wanted to thank everyone for coming out to the District 11 debate tonight, and you'll have a good night.
Not sure that's germane, but.